The nutritional risk of critically ill patients is determined by their nutritional status at the time of admission to the ICU and their current severity of illness. Up to 75% of all intensive care patients suffer from non-specific malnutrition or protein energy malnutrition. This increases the mortality rate of this patient group. In the context of medical nutritional medicine of ventilated patients, the international and national guidelines recommend indirect calorimetry to determine the resting energy turnover and therefore the caloric target. The resting energy turnover of critically ill patients is non-constant but highly fluctuating, depending on the patient, the phase of illness or pathophysiology, and the severity of their illness. In this case, an estimation formula quickly reaches its limits. Only measurement by indirect calorimetry makes it possible to correctly detect high fluctuations of the individual resting energy metabolism. When measuring oxygen uptake and CO2 production, indirect calorimetry also allows monitoring of the respiratory quotient and therefore an estimation of the predominantly oxidatively metabolized energy sources. Löwenstein's LEOMETRY facilitates simple nutrition monitoring in ventilated patients. By adding the ZISLIN metabolic module to ELISA ventilators, bedside indirect calorimetry can be performed at any time without additional monitors and is as simple as end-tidal capnometry. The technological advancement of the method, which has been known since the 19th century, makes additional monitors for indirect calorimetry at the patient's bedside and any time-consuming calibration of the sensor technology superfluous. Additional flow sensors, the need to disconnect the ventilated patient to position the sensor, or additional dead space volume are a thing of the past. By using consumption-free paramagnetic instead of galvanic oxygen cells, follow-up costs are reduced, the environment is protected, and measurements are optimized. LEOMETRY, the gold standard for accessible nutrition monitoring of ventilated patients.